Hi, it's Tourette Syndrome Awareness Month, May 15th to June 15th. Here is video number 3, and it's some facts on Tourette's. So what exactly is Tourette Syndrome? Tourette is a neurological condition or brain-based condition that causes tics, and tics are involuntary sounds and movements. Here's an example of what some tics may consist of. Simple motor tics include eye blinking, lip licking, shoulder shrugging, and head jerking. Complex motor tics include jumping, touching nearby objects or people, spinning around, imitating others' actions, that's exopraxia, and inappropriate behaviors, copropraxia. Having trouble with pronouncing those. Simple vocal tics include sniffling, grunting, throat clearing, humming, other just little noises, making, like just maybe repeating syllables, or just any little thing like that. Complex vocal tics include uttering words and phrases, changing the pitch and volume and voice, repeating something they've heard over and over, that's echolalia, repeating words, palilalia, and uttering obscenities, coprolalia. These sounds and behaviors are involuntary and are not done by choice. And no, it's not awesome. Tics can be embarrassing and uncomfortable. In some cases, they can cause headaches, migraines, muscle strains, and worse. Tics are uncontrollable, kind of like when you feel the need to sneeze or hiccup. They can be held back temporarily, but they're going to have to be released. And when they are, they're going to be much worse than if they're just like let go to begin with. Tourette's is a genetic condition, meaning it can be passed from a parent to a child. That's exactly how I ended up with Tourette's. My dad had it first. But my little sister does not. Even with the significant genetic factor, there are some studies that indicate prenatal, perinatal, and autoimmune and environmental factors may contribute to the severity of symptoms. Tourette's is often portrayed and believed by many to just be involuntary shouting out of obscenities, coprolalia. And this is actually very rare, and the least common symptom of Tourette's. Only about 10% of people with Tourette's actually have this. And it's not even part of the requirement for getting symptoms for getting diagnosed. Tourette syndrome often comes with co-occurring conditions. These include anxiety disorders, depression, ADHD, autism, behavioral problems, learning disabilities or learning disorders, sleep issues and problems, OCD, problems with speech, and much more. I personally have a severe anxiety disorder, depression, bipolar disorder, ADHD, OCD, sleep problems, and I think that's it for now, for I know of. There are medications to help with Tourette's, but some often come with a wide variety of side effects. Some don't work for some people, some work, but the same ones that don't work for others will work for someone else. I've been on haloperidol, pimozide, clonidine, and risperidone. Haloperidol was the absolute worst. It was the worst, most messed up 4 months of my life. It gave me such severe reverse effects, so it's a very strong antipsychotic, and I do not require that. And I was also put on a very high dosage when I was only 12 years old. So I started having both auditory and visual hallucinations. I became very paranoid that people were out to get me. It was basically giving me the symptoms of schizophrenia when within 2 days of being off of it, I was back to normal. Pimozide just gave me a very rapid and painful heartbeat, to the point that I couldn't even sleep. And it was actually hurting my lungs to breathe and everything. So I was taking off that in about a month. Clonidine is also for high blood pressure, and I actually have already low blood pressure. So my blood pressure dropped so low that I could not stay awake for more than 2 hours at a time, 2 hours a day, not even together, only in 15-minute periods. Every time I stood up, I would faint and fall down. I was constantly falling asleep everywhere. My heart was getting affected by it. Risperidone worked absolute wonders for me. I really wish I was still on it because my tics were drastically reduced. I had only maybe like one attack per year instead of like one every 1 to 3 months. They were only 15 hours at each, like not lasting for days at a time, so my injuries and everything were reduced by the end of them. And it also was amazing for my bipolar. It's like I still had full range of all my emotions, I just couldn't hit manic highs and lows anymore, which was wonderful. But unfortunately, it's not safe for heart conditions, and I ended up discovering I have heart problems after, and I had to be, my cardiologist suggested I be taken off of my medications. And so that's unfortunate. I think that's all I'm going to cover for today. Next video, I think I'll go over some myths about Tourette's and what is true and what's not. Thank you for watching. I will provide all the links to my sources in the bottom of the video or below. And thanks. Bye.